Anakinra is a medication used to treat rheumatoid arthritis, which can help slow joint damage and reduce joint pain and swelling so that you can move better. It is also used to treat a certain group of inherited disorders called cryopyrin-associated periodic syndromes, CAPS, including neonatal-onset multisystem inflammatory disease, NOMID, to improve symptoms such as fever, rash, joint pain, vomiting, and headache. Anakinra may also be used to treat another condition called deficiency of interleukin-1 receptor antagonist, DIRA, a condition where your body does not produce the natural protein interleukin-1 receptor antagonist. Anakinra is a man-made form of a natural protein, interleukin-1 receptor antagonist, made by the body, which helps to block the effects of another protein, interleukin-1, that can cause symptoms such as joint pain, swelling, and stiffness. The FDA has allowed the emergency use of Anakinra to treat coronavirus disease, COVID-19, in hospitalized patients with pneumonia and who also need supplemental oxygen. If Anakinra is used to treat coronavirus disease, more information about the drug is available from the patient information sheet provided by your healthcare professional. Before starting Anakinra, make sure to read the patient information leaflet from your pharmacist. If you have any questions, consult your doctor or pharmacist. If you are giving yourself the shots, a healthcare professional will teach you how to properly prepare and inject the product. If you have any doubts, consult your healthcare professional. This medication is injected under the skin as directed by your doctor, usually once a day. The dosage is based on your medical condition, weight, and how you respond to treatment. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Let the medication warm to room temperature for 30 minutes before injecting it. Before injecting each dose, clean the injection site with rubbing alcohol. It is important to change the location of the injection site daily. Do not inject this medication in an area that is tender, red, bruised, or hard or which has scars or stretch marks. Use this medication regularly at the same time each day to get the most benefit from it. Do not reuse the syringe. Learn how to store and discard needles and medical supplies safely. Consult your pharmacist for more details. Tell your doctor if your condition does not improve or if it worsens. You may experience redness, bruising, swelling, and pain at the injection site. These skin reactions are usually mild and may last 2 to 4 weeks. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Anakinra has caused very serious infections such as skin, bone, and joint infections, as well as pneumonia. Tell your doctor right away if you develop signs of an infection, including a sore throat that doesn't go away, fever/chills, cough with mucus, or spreading redness/swelling/tenderness of the skin, and bone pain. A very serious allergic reaction to this drug is rare. However, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice other effects not listed above, contact your doctor or pharmacist. Before using Anakinra, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This medication can increase your risk of getting infections or make current infections worse, so it's important to stay away from anyone who may have a contagious illness. You should also let your healthcare professional know if you are planning to get any immunizations or vaccinations while using Anakinra. It's important to discuss the risks and benefits of using this medication during pregnancy, and if it passes into breast milk, consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Anakinra Syringe. Certain medications may affect how Anakinra works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medications without consulting your doctor. Some products that may interact with Anakinra Syringe include abatacept and TNF blockers such as adalimumab, certolizumab, etanercept, and infliximab. Be sure to discuss any potential interactions with your healthcare provider. If someone has taken too much Anakinra Syringe and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. While using this medication, it's important to have lab and/or medical tests, such as absolute neutrophil count, done. Make sure to keep all medical and lab appointments. It's best to consult your doctor for more details regarding these tests. The daily dosage and optimal timing for using Anakinra Syringe may vary depending on the individual and their specific condition. It's essential to follow your doctor's instructions and recommendations for the best results. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the one you missed. Don't take extra to make up for the missed dose. It is important to store Anakinra Syringe in the refrigerator away from light, but do not freeze it. Keep all medications away from children and pets. When it is expired or no longer needed, make sure to properly discard this product. It is recommended to consult your pharmacist or local waste disposal company for the proper disposal of Anakinra Syringe. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.